How are you?
I'm great, thank you.
Thank you for joining me today. We're just trying to get some feedback based on how the program has been for the various students, and you're one of the dentists who have kind of taken the program as a self-study program because I've shared my work, and it seemed to hit the mark for you, and you've been able to use your own skill sets and knowledge and experience to add my material into your practice, and you've been able to help your own daughter, which was obviously a big driving factor for many of the dentists who join. They're not dissatisfied with the orthodontic treatment plans that are presented to them, but intuitively, many people feel that an earlier intervention, focusing on the root causes, can often bear greater change than just trying to shuffle teeth around in the pubertal timeline. Would you mind sharing a little bit about how you've been able to use my program and what benefits have been part of your treatment for your own daughter?
Sure. I was looking hard. I was already doing some expansion with fixed expanders in kids and removable in adults. And I knew that that wasn't quite what I wanted for my daughter. I was aware of orthotropics, and I had started really looking hard at the different options for training in that. And I discovered you, and yours is what resonated most with me. And I had just missed you. This was, I think, 2019, if I remember right, the end of 2019.
Yeah,
I had just missed you in the US with Sandra Khan doing a course.
yeah, San Francisco.
Yes, I had just missed it, but thankfully I was able to get access to that so I could do self-guided study online, and it was fantastic. And yeah, my daughter was my first one that I wanted to treat. She would have been 8 at the time. Um, Very helpful. Got her in stage 1 appliances. Enrico made them smooth as can be. Got them seated. Had dramatic results with her. It was fantastic. It was exactly what we needed. Treated a number more patients in my office, and then when my son was of age, I actually ended up treating him too. But yeah, it's been a game changer for what I'm able to do for kids in our area.
Oh, wonderful. The appliances that are made with Enrico at A Point obviously have a significant role to play. They're the workhorse of stimulating change in the growth and development of the children's jaws. Have you found the parallel strategy of focusing on posture important? Did you utilize my exercise program, GoPex?
Absolutely, 100%. I have one of my hygienists is trained as a myofunctional therapist, and she utilizes GoPex in her treatment a lot. We fully understand the importance of this. It is a tough thing with some to get compliance. Um, as time passes, I feel like I'm getting better at a selecting families that I know are going to be more compliant with things, and B, harping on the importance of it enough that they really and truly understand, because it's an absolute need to get that imbalance corrected, or they're not going to be growing in the right way.
Yeah, I get the feeling that people are always excited about the widget, the appliance, and they recognize the importance of the postural retraining, but in the hustle and bustle of clinical life, we tend to sideline it, and then before we know it, we've forgotten all about it. I suspect, given the importance and significance of actually treating your own daughter, you're more likely to have followed my recommendations more closely. And I know just by the nature of what I understand to be your daughter's character and personality type, she can be very disciplined and very focused because she's very athletic, right?
Yeah, she just went to the state competition for cross country this year.
Yeah, so not only athletic, but has high stamina and endurance.
Yes.
So, you know, we play a very long game. It's very time sensitive. We can't start too late, but it runs for a very long period of time. And it's a concept that people intuitively understand, but clinically, we're not programmed that way. You know, we're trying to get a balance between what is financially sensible from a clinical perspective, and often because of that, we ignore the fact that growth and development is a 2-decade long process. And, you know, trying to limit our guidance to 18 months in a 20-year process, often from a logical perspective, just doesn't make any sense. It's like me saying, I'm going to give your daughter focus coaching for her athletic career for 18 months. You just pick the 18 months you want me to focus on. And conceptually, you think, well, I want her training throughout all her schooling life at least, right? So isn't that going to be a good 10 years? Well, wouldn't we want a coach for a good 10 years? And the answer is, of course, why would we limit coaching to our children for just 18 months? Yet we do that all the time with dental treatment, let alone orthodontic care. How has it changed your practice, do you think?
Um, it's changed it dramatically. I mean, I was a pretty purely restorative and cosmetic dentist prior. I was doing some light ortho here and there, clear aligners and some light bracket and wire cases. But that was more with adults. This is what launched me into children. And I will say with some training, some other training I had before, but particularly with your training, you are so effective at nailing down and helping us understand a lot of the etiology with growth and how things diverge, how we get hyperdivergent, hypodivergent, looking at the tone, looking at everything else, knowing how what's happening with the maxilla is going to affect the mandible's abilities to grow forward. It has dramatically changed my understanding, ability, technique with, I see a lot of TMJ patients too. You know, I've done a lot of training in that as well. And it's changed my practice in a lot of ways, you know, with adult treatment I do as well, even though you're not training us in adults. It's changed how I look at things for the better. I mean, just opened up a whole new window for me to look through with that.
You know, one of the fundamentals about working in the mouth is that many of the chronic disease problems that we face in dentistry have very often the same origin. You know, TMD, you know, was debunked as a side effect of orthodontic treatment or lack of orthodontic treatment years ago by our profession. But it's debunked by using the same logic that there's no environmental causation for jaw growth and development. So obviously there's a flaw to that type of thinking, that when you drill down into the science behind growth and development, you can understand the role posture takes on, and then TMD becomes a little bit easier to comprehend and to manage. Your practice, has it grown organically, or have you put the word out? How has the change occurred? Just through your own passion, through word of mouth, through advertising? What's been your strategy?
I haven't advertised at all. It's been very organic. Starting with patients in our practice, and then people start talking to that were already in our practice. People start talking to friends. Word gets out there. So many online moms groups and everything else, and people really do start seeking you out because they hear what you can do, what your abilities are, what you're capable of. Not all of them are right, because not a lot of them don't really realize how much work is going to need to go into it on their end. There are still a lot of people that they're interested in it, but when it comes down to it, they want the quick fix, not having to do any work at home. So weeding those out, because it's not good for either of us if we start that. And I did a couple of those cases early on, and it's not fun for anybody. But yeah, as time has gone, it's been organic. The word gets out, people show up, and I see as many as I am able to and have time for.
Oh, that's wonderful. Well, I really appreciate you sharing your journey, and I'm so glad.
I am still doing restorative and all that stuff too. I don't limit to just this, because I enjoy all the parts of dentistry. So I should say that I'm managing things so I can still do the other stuff as well.
Yeah, that's the nice thing about having all the skills that a general dentist has. You can do as little or as much as everything as you want, and the ongoing care that you have to provide for the children that you look after, I think puts you in a position where you're going to not cut corners, because those patients you're going to see until they have their own kids. It's not like an orthodontic practice where you see them at 13 and 14, and then that's the last time you ever see them again until they bring their kids in at 13 and 14.
Sure.
But they're no longer your patient, whereas the children that you look after in general practice, the ultimate plan is to have them lifelong patients bringing their grandkids in to see you.
Sure.
And this is really wonderful to see. I'm so glad that we got a chance to catch up, and I very much appreciate the input that you've provided, because this will help other general dentists who might not have a thriving orthodontic practice, who are interested in developing an early intervention practice, and in particular those who have their own children of that 6, 7, 8-year-old timeline, who sometimes desperately need treatment. So thank you so much, and we hope to see you again in future courses and hear of your adventures with postural orthodontics.
Fantastic.
Oh,
Good
wonderful.
talking to you,
Oh, thank you,
Simon.
Mindy.
You're welcome.
And cut. Oh, that's great. Thank you so much for taking
Yeah.
the time and being part of my journey as well. Sometimes I don't get to get real feedback from people, and everyone who comes up to me at the end of courses, they've only got good things to say because, people who've got things that they don't like don't come up usually.
Right.
Just
Right.
and
Yeah. No, I told you, I told you, your brother and your mom before. I really do adore you, Simon. I mean, I appreciate so much the knowledge that I've gained from you and what I've been able to do with it. Yeah, I'll never be able to find the right words to thank you for it. It's just been wonderful.
oh no, there's nothing you need to say. I'm just so glad. The what is reward enough for me is to see you be so happy with how your daughter has turned out and how she has the capacity and the ability to compete at this level is no thanks in any other way than your effort to make sure your daughter has the best possible future. So it's just
I can't remember if I shared this story or not when we were in Newark, but she came home from school one day. This was last year. And she was telling me about a cute boy that was in school that she thought she had a crush on. She said, "But mom, he's got an obtuse nasolabial angle." So maybe she'll be taking over for me. Maybe she's going to be the next one to train under you.
yeah, we intuitively can recognize health. We call it beauty. It's synonymous. It's tied together so closely, and we've lost some of that, not awareness, but forthrightness because of the political correctness that kind of has invaded into all our lives. And there are many good reasons for political correctness, but it tends to also destroy our ability to see problems and rectify them early on because we're too afraid to voice our concerns. And, sometimes rather than a blanket, you can't talk about it, we should start to train people to talk about it with a caring heart.
I agree.
Because that gives you a completely different perspective. It gives people the ability to improve and to grow and to correct and to become better. Our words don't have to be negative. Even if the scenario is negative, we can find a solution if we understand. So it's just wonderful to see that you've been able to use some of the things that I've gathered over the years.
I'm very thankful for it. You've reignited my passion for dentistry. I've always had a passion for it, but then this is something that I've been the most excited about. So thank you for that.
Oh, good. Oh, so have you got holiday vacation plans? Are you doing, do you guys do anything on a regular basis over these holidays?
We are big into snowboarding and skiing. We go to Colorado every year, which is about a 10 or 11-hour drive for us. We usually drive because we bring so much, but we just bought a place out in Winter Park, Colorado. So we're going there
Oh,
even
wow.
this year. So we're going Thanksgiving and Christmas.
Yeah. Oh,
So
that's amazing.
hopefully I don't end up with anything broken. Any broken
Yes.
bones.
It used to be a bit of a passion of mine, snowboarding.
Yeah.
So
Same.
I
Everybody
can
else
only imagine.
skis. I snowboard. Everybody else
Oh,
skis.
okay. Yeah.
But I
Yeah.
can't change. I'm too old now. I can't switch what I do. So
I don't know, like the champagne snow in Colorado, right?
yep. Well, someday you'll have to plan a trip to come back this way during the winter, and we can go snowboard in Colorado.
Yeah, wonderful. Good, good, good. Okay, well, I won't take up any more of your time, and I wish you a wonderful Christmas
Thank you, you as well.
and a safe snowboarding trip
Thank
ahead.
you. Thank you. Great seeing you,
Uh,
Simon.
Great, wonderful.
Take care.
Bye bye.